It's International Overdose Awareness Day today, and I'm at the Manitoba Legislative Building in Winnipeg with Shauna Ilsley, Executive Director of the Manitoba Harm Reduction Network. Thank you so much for joining me today, Shauna. Can you tell me why we're here and what's all happening behind us?
Yeah, so we are here for International Overdose Awareness Day, and unfortunately here in Manitoba we're experiencing a drug poisoning crisis. So many of us have lost loved ones. So we're here today to honor our loved ones that we've lost, but also to invite people down to come spend some time to honor their grief, but to also learn a little bit about harm reduction and how we can better support our relatives who are using substances.
And how does the prohibition of drugs contribute to a toxic drug supply?
Yeah, great question. There's two real big things that prohibition does. One is that it creates stigma around substances, particularly around our relatives who are using substances. And in a stigmatized environment, it's really hard to go and ask for some support around your substance use. But the other thing it does is it creates a toxic drug supply. So when prohibition is the policy, it means that substances are unregulated. People don't necessarily know what's in it. People don't know the potency of it, and so in an unregulated market, it means that we're going to have an increase in deaths due to a drug poisoning. And that's what we've seen here in Manitoba, and we had, last year we had 418 people die. The year before it was over 400. Since January to March this year, we had 103 people die. And in the next month before election, we'll have another 40 people die. And so really important that drug poisoning or an overdose is actually 100% preventable, and we need policies that are going to support that.
Thank you for saying that. Some people say harm reduction measures like new needles and supervised consumption sites enable people's drug use. What do you have to say to that?
Long before we ever gave out harm reduction supplies, new needles, people were using drugs and injecting their drugs. And so harm reduction strategies really are a strategy to help people to stay safer while they're using substances. And importantly, safe consumption sites. We don't have a safe consumption site here in Manitoba. We are the only province west of Quebec that does not have one, but we are fortunate enough to have the mobile overdose prevention site, and that site saves people's lives regularly. So it allows people an environment where they're going to use an unregulated toxic supply, and if they do have an overdose, there's somebody to respond immediately and save their life. And there's no documented cases of people dying in overdose prevention sites or safe consumption sites of an overdose. So it enables people to stay alive is what we believe when it comes to harm reduction.
Well, we'll have to end it there, but thank you so much for talking with me today, and this is beautiful. Thank you so much for putting this on.
Thank you for being here.
Great. Back to you in studio.